Hi, everyone. This is Lucas Voss with Becker's Healthcare. Thanks so much for joining us for today's webinar, Unlock the Power of Quick AI Wins, and more importantly, how to unlock those quick AI wins. Before we begin, I'll walk us through just a quick few housekeeping instructions here. If you have any questions for our speakers throughout the webinar, please feel free to type them into the Q&A box you see on your screen. We can follow up to get you an answer there. Today's session is being recorded and will be available after the event. You can use the same link you used to log into today's webinar to access that recording. And if at any time you have any issues with audio or visuals, just try refreshing your browser, and you can also submit any technical questions there as well. We are certainly there to help you. And with that, so excited to have such a great panel for this discussion. Hopefully we can find a lot of those quick wins fairly quickly, so to speak. And I want to jump right into the conversation with you all, right? Doing some research for this panel and a lot of interesting statistics around this topic, certainly. 66 of healthcare executives say they're actively investing in AI solutions to streamline administrative operations and also maintain fiscal strength. And then 67%, so just a tiny little bit more there, of executives also cite pursuing AI to enhance care and meet patient expectations. So real dual fold, right? I'd love to know where some of the friction points in the patient journeys are for you that AI can address right now, immediately. What can AI do right now with the greatest potential for quick improvement and ROI? Dr. Ishii, why don't we start with you there? I saw you nodding your head. You certainly in the exploring phase there with AI. Would love to hear your thoughts on this.
Wonderful. Thank you, Lucas. Good afternoon, Lisa Ishii, the Johns Hopkins Health System. What we are focused on now is the use of AI in the perioperative space for two reasons: to help promote throughput and also to help promote site of service. So we're investigating solutions that would both review the procedure that's planned and the patient and help direct us to, is this a case appropriate for one of our ambulatory surgery centers, or is this a case that needs to be in one of our hospitals? And if so, which of our hospitals is most appropriate? So that's a solution that would be incredibly useful to us, because right now we're depending on humans to sort through those factors. I'm sure we are not unlike my colleagues on the call. Our ORs are bursting at the seams. And so we're really trying to appropriately allocate patients and cases. And we're also, along those same lines, interested in solutions that will help us with level loading of our ORs so that we can use them as efficiently as possible. Help to promote things like turnover time and overall throughput in the perioperative space. So that's a very focal solution, but it's one that we're looking at the health system level as a solution for our 6 hospitals and our 7 ambulatory surgery centers. So we'll be eager to hear if my colleagues have ideas, thoughts, recommendations there.
Absolutely. Manish, over to you. What are you seeing? I'm sure maybe similar perspectives there. And what are you seeing? What are some of those great potential initiatives, quick improvements that AI is really making a difference for you there?
Yeah, no, I think I would concur with Dr. Ishii. And what's interesting is we're trying to use AI as a foundational change agent for all of our, call it processes. So whether it be operational processes, whether it be clinical processes or administrative processes. So what's interesting is that most of the AI innovation, I'm going to put that in quotes, in the industry is going towards all of the administrative things like revenue cycle capture or ambient listening. Those are the two things that people jump to. The things that we're most excited about is actually assisting our clinicians to make much earlier diagnosis or more precise diagnosis. And, we're not too shabby at both of those things at Mayo Clinic, but at the same time, we recognize that a single individual is a sum total of their knowledge. But if we now collectively get a much larger knowledge base, you're likely going to see a better outcome. So even though we're all excited about ambient listening and revenue cycle, which are near-term abrasion points, we're most excited about actually changing the way we actually practice medicine.
Yeah. Can I also ask, obviously that's a very important part of it, the clinician experience and how you're engaging with patients along those lines too. Are you also prioritizing investments into sort of consumer facing touch points, right? Patient access to improve the communication and the billing piece. Is there an ROI framework that you're looking for there in terms of the patient engagement piece?
Yeah, I think, some interesting facts. I think there are 3,500 people with scheduler titles at Mayo. So when you think about that many people, you have to wonder if we can simplify and give them a better set of tools so they can handle more throughput, or at least reduce the time that a patient goes from first call to an actual set of appointments. And again, Mayo Clinic is probably a lot like Johns Hopkins, where these patients are complex. They see multiple specialties in their patient journey. So we orchestrating the complexity of getting all those specialties appointments done in a way that the patient doesn't have to spend a week here, it can be a day, is a complex set of math that algorithms and AI are perfectly situated for. So we're using that for what we call access management, which is how do you actually bring the patient in and organize an itinerary that makes sense for the patient, but also for the clinician and staff. So what that does is maybe takes that 3,500 set of schedulers and gives them a lot more capacity to handle, and then obviously reduces the time between first patient contact to all of their itinerary identified, which is going to result in a much better outcome for the patient. They're going to feel a lot more connection to the organization.
I was going to say a trickle down effect, right? Trickle down effect to the patient experience, and then obviously better outcomes related to that in all regards across the organization. Matt, welcome. Would love to hear your thoughts as well on this too. Where are you seeing the greatest potential? Any specifics that you're working on? What are some of those friction points that you're really looking to AI to take the lead in bringing some of those quick improvements and ROI to the case?
Yeah, thanks. I really appreciate Manish and Lisa's comments, because we're at USF and Tampa General completely aligned with what they're doing. I think what Manish said there that really resonates with me is that there's this opportunity to enhance the patient experience by enabling flow and care coordination in a way that's completely different. One of the things that we're doing that hits right on what he mentioned was we've got a partnership with an AI company that's using very standardized photographs of the eye in our primary care setting and detecting very early diabetic retinopathy, the leading cause of blindness in the US, that can be intervened on early and resolved. The easiest way to chop down a tree is when it's a sapling, right? So I think AI helps us capture these problems before they're much, much bigger. And we've invested substantially in this concept of patient flow. It's mainly right now in our inpatient setting, but trying to understand and use AI to predict where patients are going in our system next, and making sure that the downstream resources have the capacity to manage that patient flow is really I think the coordination of the future, where AI, as Manish said, is perfectly set up to help us move those puzzle pieces around and reduce the friction.
Yeah, a similar question as well, and it connects to what you were just saying, but it is then also you are also prioritizing the patient experience and sort of the consumer facing touch points. Is that correct? Is that what
Yeah,
you're working on
I
as
mean,
well?
absolutely. We're doing everything as well in sort of the call center space, the RCO space, the ambient listening space. That's really great. And if you look at the ROI of those direct interventions, you can connect hard dollar time savings. But the purpose of that is, and the real value is in that soft dollar repurpose of the physician's attention. Or of the human being that used to have to fight the denial tooth and nail by themselves. What else are they able to do to support the organization's mission? So I think that's where we're so. I mean, this even the fact that we're having a panel on this makes AI feel like it's something, this like wild new thing. We've been evaluating technology our entire careers. This isn't any different than that. It's just moving a lot faster.
Yeah, that's right.
A lot more innovation across the board. Chris, I wanted to come to you here too, from your perspective, right? Especially around the statistics of this, right? You have a lot of conversations with leaders around AI, with the C-suite around this, right? Obviously, over 60% want to do this or actively investing in this. What's your perspective on this? What are you hearing about some of these easy wins, right? What are folks saying? What are the conversations look like from your perspective?
Yeah. So thank you. Chris George, I lead the hospital and health system practice at A&M. So, I mean, I appreciate all the use cases we're hearing, and I think every client that I work with is in a different level of maturity when it comes to AI. And it really goes back to Matt's comment about this isn't any different than any other technology. It's moving much faster. I think there's a lot of legal aspects to it that depending upon the risk tolerance of the organization, may be impeding the adoption of certain AI technologies. But the one thing that I'll say is all our clients are looking at it from solving their business problem perspective, right? And some of it is return on investment for some of the things that Matt talked about in terms of access, ambient listening, contact center, rev cycle. But it's really great to hear, and I don't see this as much on the patient throughput size. Like peri-op, I've not heard that too many times, Lisa. So you guys are probably more likely an innovator in that space, which is great. And I think it creates some new opportunities for health systems who really are, starting to struggle financially with some of the federal changes that are coming. So I will say a lot of clients are looking at what we call revenue diversification strategies. And this is a great area to do it in. If you're trying to solve a business problem at your organization, the likelihood of that problem existing at other organizations is very likely. So finding a solution for your own organization is helpful, but then trying to figure out a way to commercialize it, either through a joint venture with another facility. Private equity has a lot of dry powder on the market. They're willing to make investments. But it is really an exciting time. And I think is really forcing a lot of health systems to think through what else can we create to really continue to fund our mission, because we're not going to be getting more money from Medicare and Medicaid. We're going to be capped on commercial. And so I think AI is really in a good place to really help health systems innovate.
Yeah, it opens up the business piece of this as well, right? And the ROI piece from a completely different conversations perspective, which is really interesting. Scott, I saw you nodding your head there specifically on the fact that this is, we've been doing this for a while. It's just more transformative as to where we are in time. I'd love to hear your perspective as well on this from the conversations that you're having in terms of what are some of those use cases that you've seen that are interesting to you, but that are also, right, low friction, that you're really seeing making an impact right away.
Yeah, absolutely. Hi, I'm Scott Dontremont. I'm the CEO of Parlance Corporation. And we hear a lot about a lot of what we're hearing today, the sort of chase for efficiency and the need to kind of make some common sense adjustments, leveraging this new technology platform is something that people are paying a lot of attention to. Some of the fastest and most sort of easy things to do are around navigation of phone traffic, believe it or not. It seems like something that should have been done long ago, but we're like 50 years into push button menus in many places around the country today. And where we'll see customers kind of really pushing forward some real innovation in some areas, we'll see them, still back in the ages where it's, press 1 for this, 2 for that, listen closely, our menu is changed. And
I was going to say,
unfortunately, that results in patients and families often being transferred all around the healthcare system. And there's just not a lot, or hasn't been a lot of infrastructure to support things like one number access to the healthcare system. I was speaking with somebody the other day. They run a 200-person call center. that handles about 30% of the traffic that organization gets. So if you needed to schedule an appointment with these guys and you're part of the 30%, it's fine. 70% of the callers wait through a queue to get to an agent that then transfers them somewhere else where they then begin all over again. So we're seeing a lot of uptake on kind of the really easy part first, like navigation, and then leading to much more curation of appointments. It really resonated with me when I heard the conversation around there being 3,500 schedulers, and the also hearing the complexity of getting people all there in one day. AI is going to really help that a lot, but you're also going to have a pretty sophisticated person doing that. And there's just a general efficiency uplift if that same person, who's probably fairly highly paid, isn't also giving directions to the facility that could just be received in a link. So I think it's that blend. I think it's elevating the people that are in these positions and paying attention to the common sense aspects of it that are going to make a real difference.
Yeah, absolutely. Matt, go ahead. I saw you there.
Yeah, we just went live about 5 weeks ago with an AI agentic front end of the phone call system. And it's been like quick win transformational. About 80% of the calls that our agent has answered, and it's kind of weird because I refer to her as a she, and we actually got a cardboard cutout and we put it in the cube at the call center and we decorated it and we welcomed her. But like she's answered 150,000 calls, and 80% of them are routing appropriately. Like in the first week, the same scheduling department with the same number of agents made 20% more appointments.
Right.
Because it had filtered out what needed to go everywhere else. Now, that's created other issues, because one of the things where we were staffed in certain departments not to get all the right calls. And now they're getting all the right calls and they're going, whoa, that's the problem. So, technology implementations, they don't fix problems as much as they help you see where they are. And so I think that's another huge opportunity for operators to become more efficient.
Yeah, absolutely. And I do want to stay with the scheduling piece, because I think, again, that's what we're hearing a lot about right now. Many health systems are piloting AI in call centers, right? Scheduling, billing, all of those different use cases. I'd love to hear more from the group too. What are some of the implementations? Matt just mentioned his, right? What are some of those implementations that have demonstrated the biggest impact across like phone, digital, in-person channels, right? And then also, can you highlight some of those specific implementations in that area that you've undertaken within your organization to really demonstrate some of this, to show measurable results, and also the impact on patients? Dr. Ishii, why don't we start with you on this too? What have you seen in that space in regards? Oh, I think you're still on mute. There we go. Yep.
Far and away, where we've had the biggest impact so far, it's already been mentioned, it's in ambient listening for our providers. So we went with a full health system implementation for all 4,000 of our providers 6 months ago now. And if you ask our providers the impact that it's had on their practice, they say it's been the most important thing to happen to them, sometimes ever. So the ability to not have to spend pajama time, as we say, working on notes in the evening has been game changing. So having our clinicians who are feeling more empowered and more engaged, less burnt out, finding joy again in what they do every day has been absolutely fantastic. So we've been thrilled with that implementation. The one concern that we have about it is, excuse me, it is using artificial intelligence, and it does require editing and correction. And so the data that we get from those provider notes will be dependent upon the accuracy of them and the providers going back to confirm the accuracy. So frees up a tremendous amount of time, but still requires some work that we're just encouraging our colleagues to be sure that they continue with that piece of it, so that all of the data that we get on the other side will be correct data.
Since that has shown so much success to, is that obviously ambient listening is a use case for you specifically? Is that driving maybe change in sort of like call centers, for example, scheduling, billing? Are you seeing anything there? Are you doing anything in that regard in terms of AI implementation? Right, again, digital access in person, et cetera. What are you doing there in that space?
We are, and it, anytime you have a win on the low hanging fruit, then it encourages you to go forward and do more. So yes, we're also undergoing an implementation in our access center with a tool using AI for scheduling as well. We just don't have it in yet to have the results from it.
Yeah.
And
Yeah.
then, of course, the back office functions that have been mentioned already, revenue cycle, supply chain, et cetera. But in terms of what we have done, where we can absolutely say, wow, the ROI here is very real, is with ambient listening
Yeah,
so far.
absolutely. Manish, go ahead.
Yeah, I think it's important to call out the difference, because we use this, these two letters very freely, AI, and I think it's important to call out what we mean in different contexts. So I'll give two examples, one clinical example, and then I'll jump back to your scheduling question. So if you think about an algorithm that looks at the clinical record to assess whether a patient needs a statin, okay, fairly simple algorithm at this point because it's a tried and true set of decision criteria. That algorithm is a mathematical equation. Still could be AI. Automation enabled by AI is that algorithm sitting behind a set of tools that a clinician or a nurse can say, okay, this patient's been flagged as needing a statin. Let's order them a prescription. That is now a automation step that reduces the burden on clinician or administrator or nurse. Agentic workflow is where that happens, where the calculation is done and that statin is ordered without any intermediate step by an individual. So when we think about AI plays a role in each one of those steps, clinical decision making, automation, or agentic workflow. It's important to call out those three types of uses of AI because sometimes we jump around. So on scheduling could be help me organize my schedule for my OR or for my GI practice. Automation could be help me structure all of that and align patients against it. Agentic, which is where we're headed, is really to do this dynamically without any human intervention or minimal human intervention. I think on the scheduling side, we're probably 2 to 3 years out at a minimum because what it requires us to do is to change the very processes that make us really good as institutions, which is to not drop anything in patient flow. And that requires a lot of trust in these tools that are not perfect. Remember, AI tools are inherently probabilistic tools, so there are going to be error bars in there. And Dr. Ishii just highlighted an example of that in ambient listening.
Yeah, absolutely. I want to touch on the readiness piece, and Scott, I'd love to come to you on this too, because I think it's an important part that Manish just mentioned, right? The readiness for organizations. Again, you work with so many health systems across the country on this as well. Are most of those systems ready to integrate with EHRs for those, some of those personalized answering and scheduling pieces? What are you seeing there? And what steps do you see systems take right now, or what steps should they take, right? Why is that so important for long-term success within this piece?
Well, it has to be a journey. Manish put his finger right on kind of the fundamental issue is sort of standardization on the back end. And I would say that might be 0% across the country where, people have worked out all the details and a way in which we're going to be able to schedule appointments when Dr. Jones only operates on left knees on Tuesdays. And there's a level of specificity per provider that is difficult. Now, agentic AI is making it much easier to find and be much smarter about finding those slots. But at the end of the day, it's a partnership with the healthcare system to work towards common sense standardization. Some of the finest institutions in the country that have really specific providers are not tomorrow going to only schedule appointments one way. So it's a blend. So sort of the entry point to all of this is the stuff everyone can agree to. Like, let's say we just want to reschedule, a particular appointment with the same provider. Well, we already have all this information. AI can easily find that slot or navigate a call to the right place, that sort of thing. So what we've seen a lot of is sort of starting small, outlining the journey, and then working with our customers in a way that we all arrive at the same time with some solid improvements, and we don't try to go too far. Hallucination is a real issue. Agentic AI makes that a lot easier. We have techniques now to kind of judge the criteria and know that we're accurate. There needs to be a lot of guardrails about how you move forward with this sort of technology, but it gets better literally every quarter. A year ago, everybody was like, you couldn't use generative AI in the voice channel. It just, it's not latent. There's too many hallucinations. And now we and everyone in the market sort of only uses that at the cutting edge of this stuff. And it's just kind of a wild journey.
Yeah, I love that Manish mentioned maybe 2 to 3 years, right? I think that's a good time frame to keep in mind with all of these developments. It's going to take time.
I think it's optimistic, honestly. When I think
Absolutely.
it's kind to people on our side of the thing to say that we can figure it out in 2 or 3 years. I think it's going to take a long time because there's humans involved,
Yeah.
and there's just a lot of common sense things that you don't want to lose in the patient experience where people can get to people. So we want to think more about kind of elevating, people that work in systems to do a better, free up time to do a better patient experience. As Matt said, now all of a sudden they can schedule 20% more appointments.
Yeah. And you mentioned a very important point, which is the human aspect of this, right? We haven't really touched on it yet, but just slightly. It's so important for implementation, usability, and I believe also success. Chris, I'd love to come to you on this one too. Can you talk a little bit about the role of change management in this? What are some of the conversations with leaders around AI implementation when it comes to change management and setting an example around AI? Are you seeing successful conversations with leaders? How are they prioritizing actually making sure that this is, it's not a burden for folks, this new technology? What's your perspective on change management there?
Yeah, well, I think it's forced organizations to rethink what their governance is. A lot of organizations that I've worked with, they don't necessarily have good technology governance, especially in the academics. A lot of vendors that are being used by certain departments, but it's really forced organizations to think through the right governance model for AI, as well as data governance as well, right? Because you need solid underlying data to be able to leverage it. And then I think the other thing that's going on relative to just change management is a lot of the existing big vendors are building AI into their platforms. And so strategically, organizations really need to think through what the best use cases are for their organization, and then what the roadmap is to get there. And if you don't have appropriate governance in place, it really makes it difficult to make progress on any of these AI initiatives. But it starts there, and then it starts with leadership and getting the operational people involved that are going to be most impacted by whatever use case you're implementing. And for a lot of operators, that's not an easy change to be thinking about putting in a technology that, eventually may eliminate some people in your organization, but certainly will help accelerate. So really putting that benefit to the patient in communication to broader audience becomes really, really important to get your operational leadership on board with whatever AI initiatives you want to move forward on.
Yeah, Matt, I'd love to come to you on this for this question as well, because again, you've mentioned some of the use cases, right? Some of the implementations. You're very straightforward with having AI do a lot of the things and bringing a lot of the things. What does this look like for you, how are you ensuring that AI feels like a relief for patients and staff rather than just
Yeah.
another system that they have to manage?
Yeah, I mean, initiative fatigue is a real thing in our organization, and I'm sure everywhere else, right? So I think that the unification of strategy is critically important, and the governance structure that was just talked about, it also is so important, right? There is some concern about this. Feels like the Wild West. Do we know, what do we know about it? What do we don't know about it? What should scare us about it? And we've got a very forward-thinking IT department that has a really cool structure that's been having a specific AI governance meeting now for 2 years with multidisciplinary stakeholders, evaluating the business need as well as the reality of every other technologies we would look at, right? The security risks, the compliance risks, the things that are just going to be applied regardless of what type of technology. When that has sort of been endorsed, it arrives in sort of a way that has a full vetting, and our companies and our employees, our team members all the way down to the front line understand that, hey, we believe in this. And we're all in academics, right? It's the basis of this is learning and experimentation. So we very rarely select a technology and say, this is going to be the greatest thing ever, and it's going to work as soon as we open the box. We always say, hey, we need to try this and figure out if it works for us. And if it doesn't, we're going to go back to the drawing board. I think the most exciting thing about AI is we're turning things on, we're finding where it's broken, we're working with our partners, and we're rapid cycle improving faster than any technology that we've ever been with before. So I think that's actually engaging folks in the change more. I'm so proud of our contact center because I think they could have been very scared by this intervention. Actually, they're finding more purpose because their connections with our patients are more meaningful.
Yeah. Which is really the key and the result, the outcome that organizations are looking for, which is tremendous. Dr. Ishii, go ahead.
Thank you. I just wanted to pull on the thread. Chris called out the importance of governance. And when I consider changes that we've made that have been so incredibly important for our success, it has been both our data governance, as he called out, and our AI governance. And we have made the decision, to his point about academic medicine, we've made the decision to make these decisions at our system level. Again, we have 6 hospitals, including our neighbor, Matt's neighbor down in Clearwater, St. Petersburg, and our primary care network and our ambulatory surgery centers. We make decisions at the system level. It's really unusual that we move forward with a solution that would be based only at 1 or 2 of our entities. We're really thinking for the call out around there are so many bright, shiny objects out there, and how do we keep ourselves from working with an unlimited number of vendors, number one, but also, as has been called out, the security risks that go along with that. So having the governance model, having the expectation that we're all doing this together for solutions that make sense for all of us, rather than every hospital choosing its own technology solution to work with and having chaos that's not interrelated, and et cetera.
Yeah, absolutely. And Manish, I see your hand. I'll come to you in a sec, but I found a really interesting stat related to our conversation here, which is that 85% of health systems are using AI internally, but only 17% have a mature governance structure. So, and that's very telling as to this conversation, right? It's very important. Manish, go ahead.
So oftentimes in these panels we all agree, but this is an opportunity to have a different viewpoint, which is great, conversation. So we took an approach because Mayo's culture is fairly flat. Each of the departments, each of the subspecialties operates fairly independently in their own practice. So there are certain decisions that for AI-based solutions that cuts across, like ambient listening is an example that we said we're going to choose a couple of vendors. One of the things we said was we're not going to commit to any one particular vendor, and we've been purposeful about that because we recognize that vendor lock-in is a real problem and a real challenge for organizations like us. So we always try to hedge our bets, if you will. But the more interesting part of this is that we said, let's enable choice. So today, we have a little over 300 different solutions across our clinical sub-practices that are deployed. We have a fairly mature integration model that protects patient privacy and ensures security, but it allows us to do rapid innovation because the issue with AI is that it's changing and evolving so rapidly that if it takes you 2 years to go find a solution, contract them, they might be irrelevant by the time you actually go live. So you need to figure out a model that allows rapid change management, and that can only happen in small pockets. Our hope is that you get to a point that each physician, each sub-practice area can actually make its own set of decisions, but we give them the scaffolding and framework to be able to do that. And that will always push us forward versus, have these monolithic things that all practices and sub-practices have to abide by. And as an academic institution, the magic really happens at the subspecialty level.
Yeah. Can I ask then, though, as a follow-up to that is, what are those, you mentioned there's mechanisms in place, right, to be able to regulate personal identifiable information, et cetera. How are you balancing that speed with oversight? Is there, apart from those mechanisms that you have in place?
So our integration model basically creates a safe spot. So think of it like a blast zone for any of these solutions. So that instead of giving them access to the entirety of a clinical record, we give them access to a sub component, or we only turn it on for a number of physicians versus the entire enterprise. So the what's it called? The blast radius of any of the consequences of these are fairly limited. And so that's the approach we've taken. And we've got standardized contracts. We just don't negotiate those contracts anymore. So there's a handful of processes that we've been able to implement. And again, a lot of it is if a solution, AI-based solution, is nothing more than a intelligence layer, data connectivity layer, and a UX, we don't need every vendor to come in with the entire 3 components. We can maybe say, come in and integrate on our platform and bring your intelligence. We'll bring the UI and data integration, which actually also changes the conversation, what gives us a little bit more certainty that these solutions are not going to be harmful because we control a lot of the critical layers.
Yeah, it's an interesting perspective, and it certainly enables innovation. You're right. It certainly enables folks to be able to react more faster to innovation. Scott, I'd love to get your thoughts on this as well, from a governance perspective too. What are you hearing there? Are folks more aware? And certainly the approaches that you've just heard, right? What are your thoughts on this?
Yeah, I'm kind of nodding along. It's interesting because there's a wide range of approaches to governance. We're actually hosting at the Chime Fall Forum a panel about it to kind of talk about some of the diversity of opinion. We've seen the complete actual range from organizations that say, hey, this is a new technology and we have been governing IT technology for decades and we're not going to do anything different. We're going to treat it just as the next generation of technology. We have other folks that we work with on the other side that have hired specific executives, formed, committees, come back and wanted to adjust contracts to make sure that they're protecting themselves legally, in some cases, asking us things, where the answer, you can get so close to the trees that you can go, well, what happened before can be the answer. If somebody, for an example is people will ask us often about bias. So if I have a really hard accent and for whatever reason I am less likely to be understood by AI, I might be less likely to be understood by a human as well if my accent is that thick. So you just see a wide variety of approaches. I think it's a really great and active conversation. And I think in the end, like most things, we'll all wind up somewhere in the middle where we're making some decisions about how we do things that can be scaled and replicated and safe, but lean towards the way, as Manish says, to take advantage of rapid innovation. If we just sit back and study it, we're not going to, have the kind of results that Matt has had.
But you would say that there is a critical awareness towards the topic generally in terms of the importance of it.
Yes, you have to have an opinion about how you're going to move forward, and people have had different opinions about how they should move forward that are quite different. It's not a consensus at this point from our perspective.
Absolutely. I want to come back to something that we touched on earlier in the conversation, with just sort of the measurables around it, right? And the ROI and the success of AI initiatives in general. And I'd love to know, Matt, I'd love to start off with you on this too. What are some of the frameworks or metrics that you're looking to that you have found most effective for really quantifying and saying, okay, there's satisfaction, there's staff efficiency. How do you quantify those? Financial outcomes as well, right? That are tied to AI initiatives. What are some of those metrics and frameworks that you're looking to say, okay, this is actually working?
Yeah, I think I really appreciate everything Manish has said. He's been so spot on. The pace with which you have to implement here to see real value is tremendous. We broke our own land speed record from first conversation with vendor to implementation in the call center. We did it in about 6 weeks. And part of the rationale for that wasn't really like what's going to happen if we take a long time. It was, we need help now. And I think there are in the low hanging fruit, like where it's an automated task that's discreetly captured in a source system by a human now, it's really easy to capture AI. I think where there's an opportunity is in some of this patient flow work we talked about before. I mean, the ambient listening is a great example, right? We've seen something like an 80% reduction in time spent in notes for our providers that have deployed it. Amazing, right? But how do you capture what else they're doing and where that's adding value? We've got a really exciting tool coming on to help us predict and dynamically modulate the way we use our exam room space. How do we know what templates deserve how many rooms in what part of our buildings, and match that to the demand, and not this, well, historically we gave Manish the whole 3rd floor and he gets to use it however he wants to use it. And maybe he uses half of it today, and we just that's a non-renewable resource that you have to manage. And I think those are where the backfill metrics, you have to get creative. But I will go back to saying this isn't new. Technology's been helping us with throughput our entire careers. We know how to do this. I think it's moving faster, and you've got to be more specific, because I used to say in my career when I was working more around operating room times, if everybody that sold me a piece of technology reduced operating time was actually accurate, we would have 1-minute operations, right? So you have to be really specific, and I think take a very critical eye to what is real. We all have initiatives around helping our providers be more efficient. So when Ambient is listening and taking time out of their notes, how can we be sure that that it deserves 100% credit for that work? In the call center, we've done a ton around our decision trees and our call routing. Yes, the agent is helping us schedule more patients, but we've also done a lot of work on the templates to open those appointments up too. So there's a lot of sort of confounding work that helps it, that muddies the water there. I think what we're looking for is the pace of improvement increasing, not necessarily just a single metric.
Manish, are there any specific metrics that you have found most effective for quantifying that patient satisfaction, staff efficiency, or even those financial outcomes that we've talked about? What are some of those metrics and that you're looking towards with initiatives that are tied to AI?
Yeah, it's interesting how much capital has gone into the space, thinking that there's a large ROI, and I keep reminding our investor friends that if you look at the operating structure of any hospital or any clinical setting, there are real costs that are not extractable, no matter how much efficiency tooling you put in. So the real attachable market is probably a lot smaller than we think. It's certainly not $4 or $5 trillion. So the reason I bring that up is our approach to ROI is, look, there's going to be a certain fixed cost that we're going to have to spend to really make process automation or process change or process improvement or whatever you want to call it. And so let's figure out what that budget is and then optimize that spend. To Matt's point, if you had all of these solutions that delivered on their promises, we'd be in a different situation. So we're looking at this as saying, okay, let's figure out what that number is, and we're going to benchmark that against what the IT or process spend is across our brethren. And then we determine within there if these solutions are performing and are actually attaching to real results. And it's a different way of looking at, again, your fixed costs. So instead of putting up a building and hiring more people, let's now think about taking a percentage of that and putting it into tooling. And it's a complicated answer to your question, which is what are the metrics? Because at the end of the day, the metrics come down to are patients happy? And those are standard metric, right? HCAP, whatever metrics you want to measure, and then your bottom line. So everything else, is interesting. Obviously, the clinical outcomes are also in there. But that's the way we're trying to just stay focused on these end metrics and not get too lost on intermediate ones. And I think for us, we're committing a certain foreseeable future spend on tooling that is going to change our process automation. And we have faith that we're going to get ROI out of it, but for the next 3 to 5 years, we think we're going to have to spend more because there are people that have these jobs today that we're going to have to move to different places. And in that time, we have to implement these tools. And that's actually a negative ROI when you think about it. And that's the reality.
Yeah. Again, we come back to the process itself. Dr. Ishii, I just wanted to touch really quickly on this as well. Is this similar for you when you're looking at the measurement of is an AI initiative successful when you're thinking about metrics and some of these values to these initiatives? Is this similar for you?
I'll go back to what Matt said. I think what's hard is we're all implementing a number of changes to impact productivity, patient experience, staff experience. So it's hard to put your finger on, did the AI tool do it, or was it all of these things collectively? So yes, we are looking at metrics. We're not saying we implemented ambient listening, and that is why now we're seeing more productivity from our clinicians than we saw before. And that's why we're seeing an increase in their faculty engagement scores. So yes, we are looking at metrics. We're not associating them with one specific thing necessarily, because there are so many things that we're doing at the same time.
So many different ones. It is multifaceted. It is such an interesting piece to this as well. How do we measure ROI, et cetera? And again, it's a process. As Manish mentioned, it has to be a process almost. Well, I want to thank you all so much for taking some time with us today. This is such a fantastic conversation. I do want to close this out with key takeaways from today and what you would like leaders to remember from our conversation today, what they should bring back to their organizations, right, from our conversation. Chris, I would love to start off with you here. What's that one key takeaway for you, and what would you like leaders to remember or take back to their organizations?
Yeah. Well, I will say this has been validating, right? Hearing all the great things that are going on within health systems. I think my key takeaway is it's a Starbucks recipe at every organization, right? The elements that it takes to move the needle on AI, while the elements are the same, the amount of ingredient to each element is very different. And that's the one thing I would like to leave everybody with is the recipe for your own individual organization could have some similar attributes as Johns Hopkins, Mayo, USF, but it's going to be a little bit different for everybody.
Yeah, absolutely. Scott, over to you. What's your key takeaway? What would you like leaders to take away?
Just keep moving forward. Every initiative is not equal. To kind of Chris's point, all the ingredients being different. You can kind of think about it as t-shirt sizes too. There are some smalls, mediums, and larges, and we see a lot of times where people are kind of looking only at the really big picture and moving a little bit more slowly and leaving a lot of sort of direct benefit on kind of on the table by just continuing to kind of think about it. I think we've got a bunch of doers on the call that are implementing these kinds of initiatives across the board. And as more leaders adopt that philosophy, I think, those of us that are working in and around healthcare are going to see a lot of benefit as patients as well. There's a lot of benefit to all of these technologies, and I'm really anxious to see what happens over the next 5 years. Not 3, Manish, probably 5.
We'll stay with the 5 for now. Matt, over to you. What's your key takeaway?
Yeah, I think, we talked very logistically about it. We talked a lot about a business need and technology and adoptions, but I think we have to make sure we're putting our missions first. This has to be empathy driven. It has to catalyze sort of compassion, equitable care. I mean, the reason we're all doing this, adopt these things with a purpose. Don't just adopt them because somebody else is adopting them or there's some sort of shiny object. Be relentlessly focused on the people that we serve.
Absolutely. Manish, over to you.
Yeah, I just building on what Matt just said, at the end of the day, our primary objective for all of us is our patients. And so if it doesn't make their lives better in some way, either an outcome or experience, then you got to wonder. Then certainly our staff is a close second on that. I would just leave it with this. I'd say focus on your data. At the end of the day, organizations get too enamored in AI, and there's a lot of information that we just are pushing paper around. So focus on digitizing, organizing, maintaining that data, and that will tell you the direction you have to go to. Because Chris is right, each organization is unique and has a certain bias, certain cultures and way of operating. Without having all that data organized, you're not going to know, and you're going to be beholden to little pieces of the puzzle versus the whole thing.
Yeah, absolutely. Last but certainly not least, Dr. Ishii would love to hear your key takeaway as well.
I really appreciated the comments of all my colleagues and agree with all of them. Would only add, gosh, I'm incredibly optimistic about what lies ahead. Matt hit the nail on the head, and Manisha as well. At the end of the day, it's all about our patients. From a practical perspective, I think leaders need to be clear on their mission and their priorities and make that be what guides them. And then finally, a reminder that we are all in this together, and settings like this are so incredibly valuable. I learn every time I engage in them, and the extent to which we all move forward as partners in this effort, I think we'll always go further together.
Absolutely. I think that's a great note to end our conversation on. I want to thank you all so much for being here, for taking some time to discuss with us today. I certainly want to thank Parlance for sponsoring today's webinar and bringing us together for this conversation. Wouldn't have happened without them. And again, thank you for your time and insights. This was such a fantastic conversation on behalf of Becker's Healthcare. So glad to have you here, and we hope you have a great rest of your day. Thank you for being here.